Today we have the pleasure to receive Jean-Pierre Chanoine from Vancouver. He is one of the faculty members that teach at the Obesity Boot Camp held in Duchesnay Station in Quebec. So Jean-Pierre will talk to us today about childhood management, treatment and prevention.
The treatment of child and adolescent weight excess involves changing lifestyle and focusing on family issues, on diet and on physical exercise. I'm going to give you a few practical tips at these three different levels. First, at the level of the family, it is most important to first ensure that the family is motivated and ready to make these changes. If this is not the case, the first attempt should be to try to increase this motivation. The second part is that the family should always be involved in any changes that are performed at the family level. It is not appropriate to ask or to expect the child or the adolescent to make all these changes by himself or by herself and be responsible for the management of the weight. It is also important to identify the stressors inside of the family that can lead to excess food consumption or decreased physical activity. I'm thinking, for example, about family fights that may have a stressful effect on the child and affect his behavior. One important step is also to teach the family how to recognize these stressors and how to deal with them. Family meals should be encouraged. It is important and surprising to see how many children do not actually take their meals with their family. And meal time is an important aspect for the family. That's a time where they can exchange information, where they can tell stories, and they can also easily manage the food that they are eating. And finally, we could and should reduce the conflicts around eating. The family or the father or the mother are in charge of presenting the food on the table, but the child should be in charge of managing how much food he or she wants to eat. In terms of very practical aspect, we should try to make one change at a time and to stick to this change. One change at a time means, for example, to stop eating food in front of the television. And being very specific means, for example, deciding that twice a week Junior is going to go and see his friend Daniel and have a meal with his family, for example. Or that the family is going to decide about 1 or 2 family meals on specific dates with a schedule that will be made possible for this to happen. When it comes to diet, I'm also going to give you a few tips that will lead to the modification of the diet towards a more healthy diet. First, we should try to stay away from fad diet or for very specific diet that favor one nutrient above others. It is best to try to have a balanced, natural diet that will contain all aspects of and all macronutrients. We should include veggies, we should include fruit, we should include cereals and grains. We should also try to limit the consumption of sugar, sweetened beverages. These bring calories that are not necessary for daily life and that have very little nutritional value. We should also try to eat slowly. For example, after taking a first serving, if we wait for 20 minutes, this gives the time to the body to understand and feel whether there is a need to eat a second serving or not. When it comes to making changes, we should focus on the positive changes versus the negative changes. Focusing on positive changes will be, for example, to favor positive foods such as veggies, such as fruit, instead of forbidding to take additional foods that are deemed to be bad for the health. Automatically, by favoring the healthy foods, this will tend to decrease the bad foods. When it comes to treat, we should not remove the treat from the diet completely, but they should be part of a specific normal diet and be given only under some circumstances. Breakfast is an important meal of the day, and you will be surprised to see that many children do not actually eat breakfast and just skip it every day of the week. Encouraging breakfast is the start of a normal day and should certainly be an important part of the treatment of weight management. Limiting eating out and limiting the fast food is also an easy part of weight management and will decrease the consumption of high calorie and dense foods. Finally, Many children and families do not recognize what a normal portion size is, and focusing on explaining what the size of a normal portion of a foodstuff is an easy way of limiting the quantity of food that is consumed. The management of child and adolescent weight excess is expected to take and to last for several weeks or several months. We are aiming at making a change in behaviors that will last for many years. Therefore, it is not expected that a full weight management process should take just a few days or a few weeks. We are really aiming at having it for the next few years and, if possible, for the rest of your life.